the beginning, scientists have said it's clear the disease doesn't pose a serious threat to healthy children, but the CDC is still recommending COVID vaccines for kids. Today, we look at the selective information being taught to doctors about that topic. Today, most countries have officially determined that most kids don't need COVID shots. But in the U.S., the CDC still recommends COVID vaccinations for babies and children 6 months and older. And I found that American doctors are sometimes being given a slanted picture of the safety and effectiveness of COVID vaccines in children.
Welcome everybody to the final.
In May of 2023, the website Medscape, which has a left-leaning pro-pharmaceutical industry tilt, posted materials for a class about COVID in children. The course is a continuing medical education class offered to doctors to keep their licenses current. But the posted class materials don't directly address one simple, important question. What's the risk to children from getting COVID compared to their risk from getting the vaccines? And the doctor's class also doesn't acknowledge important cases like that of Maddie DeGarry, profiled last year on Full Measure. Maddie may have been the first child injured by COVID vaccines. At age 12, she entered Pfizer's clinical trial at Cincinnati Children's Hospital within hours of her second experimental vaccine dose on January 20th, 2021. Her health fell apart.
She said she felt like her heart was being ripped out. So chest pain, she had severe abdominal pain. She was hunched over when she walked through the door. Her toes and her fingers were white, and they were like, when you touch them, they were ice cold.
Soon Maddie couldn't walk. By the time she was hospitalized for a third time, she was so sick she couldn't feel her legs, had an abnormal heart rate, was suffering seizures, passing out, vomiting, unable to swallow or eat, and had to be fed through a tube. Maddie was eventually diagnosed with a paralyzing immune disorder known to be associated with COVID shots and flu shots and other vaccines. But before we check to see if Maddie's case is reflected in the doctor's continuing medical education course, it helps to know who's presenting the class. The three instructors are introduced by their distinguished professional titles without mention of their extensive vaccine and drug industry ties. Not mentioned, instructor Dr. Barbara Rath is a consultant or advisor for AstraZeneca, GlaxoSmithKline, and Roche. Instructor Dr. George Cassianos advises or consults for Merck, Novavax, Pfizer, Sanofi, Takeda, and Valneva. And instructor Saul Faust has relationships with an A to V list of vaccine manufacturers: AstraZeneca, GlaxoSmithKline, Johnson & Johnson, Moderna, Novavax, Pfizer, Sanofi, and Valneva. Looking at the presentation, it claims that COVID vaccines are up to 100% effective in kids. The generous definition of efficacy is questionable. The quoted figure only measured whether kids in the study had COVID 1 week after their second vaccine.
The efficacy against 7 days after the second dose was 100%.
Furthermore, the fine print at the bottom of the slide claiming 100% effectiveness indicates that stat is from the study led by Dr. Robert Frank, the one Maddie was injured in. In his findings, Dr. Frank reported there were no vaccine-related serious adverse events and few overall serious adverse events.
Lie.
That's exactly what doctors were led to believe in the continuing medical education class.
The adverse effects were mild to moderate and in the form
Lie.
generally of injection site pain, headaches, fatigue, but no vaccine-related serious adverse effects.
For the purposes of educating other doctors, Maddie DeGarry simply doesn't exist.
Oh, but that was just one person that you know about.
Interest in the medical field and other reasons why we're growing sicker even though we're spending record amounts on healthcare. Check out Follow the Science, How Big Pharma Misleads, Obscures, and Prevails. After a break, what's ahead next week on Full Measure?